Hello, I'm Dr. Hannah Capon and I'm here to talk to you about living with arthritis. This is the lovely Luna. She is the successor of my other dog, who I sadly lost, called Holly, but who was a real inspiration with setting up Canine Arthritis Management, which is an online educational resource for owners of arthritic dogs. So it's really something quite close to my heart. Now, what can we do to make sure that these arthritic dogs have long, comfortable lives and get your dog more years? Firstly, have a good working relationship with your vet. They are the only people that are legally allowed to diagnose and prescribe. So they're going to be there for the long run with you. So start building up a good rapport. Work well with your vet nurse in the practice. They're going to give you all the tips, the hints. They're going to be trimming the claws. They're going to be shaving the fur between the pads. They're going to make sure that the dog's weight's appropriate. They're going to give you advice about diet, etc. So make sure you work well with your nurses. Talking about diet, you need to make sure that your dog's got the appropriate weight. Excess weight carriage is bad. It's going to make the pain of arthritis worse, as well as the loading through those compromised joints. So we need to get them at a body conditioning score of around about 4 to 4.5 out of 9. Ask your nurse. They're going to be able to help you. The next thing we need to do is make sure that they are not in pain. And that's something that's really, really important. Because if something is painful, they're not going to use it. And if they don't use it, they will lose it. And if they lose it, other parts of the body are going to have to work harder. So let's just run through this. If you've got painful hips because you had hip dysplasia and it's uncomfortable to use them, then that dog is going to throw their weight forward into their forequarters and their front end is going to work harder, their back end is going to work less. If the back end works less, they're going to become weaker. If they become weaker, those joints are going to become more painful. And you get this negative cycle. And it will get to the point that those back legs aren't very functional at all, and that dog will have difficulties getting to their feet. They'll have no capability in their back legs to push them up and get them up from a lay and up and moving. So you want to make sure that pain control is a priority, so that if they don't feel uncomfortable, they will continue to use it, which they must do, otherwise they'll lose it. Pain control is really, really important. Next thing to talk about is exercise and lifestyle. So there is a real need to keep these arthritic dogs moving. We want them to be exercising, but we want them to be doing the right amount of exercising. There is a balance to be had. Doing nothing is terrible. Doing too much is terrible. We want the right amount of exercise. And many vets say doing it little and often, but also looking at the activities that you do. So we want these dogs to be out walking, jogging, gently running. We don't really want them chasing things, stopping and braking suddenly and torsion through those joints and landing heavily, because that's just going to aggravate that joint pain. So think about the quantity and the quality of the exercise you're doing. Make sure the home environment is safe. These dogs are going to be less able to navigate normal daily obstacles such as slippery floors, stairs, thresholds, etc. So make sure that you've got traction down on the floor, so grippy rugs, carpet, things like that. Make sure that they have easy access in and out of the house, maybe a few ramps, maybe some steps to make it easier for them. Make sure that they're not running up and down the stairs unnecessarily. Make sure that they're not jumping on off the sofa unnecessarily. So try and think about the home environment. Next thing is to think about supplements. It's a tricky topic because we've still got a lot to learn. And it's not a regulated area. So that means that we don't exactly know what is in some of those supplements out there. And we don't exactly know how effective they're going to be. Now, a supplement is there for joint health. It is not a pain relief. And I really want you to remember that. So a supplement is there trying to make sure that the joint is healthy. It's not going to be an alternative for seeing your vet and getting pain relief if we believe that dog's painful. Next to think about is other complementary therapies that you think might have a good role. So that might be hydrotherapy, physiotherapy, massage therapy. These things can have a really big impact on your dog's comfort and their capabilities. So when you look at all the things that you can do for your dog, there is loads. I've only just tip of the iceberg. If you would like to know more, please head over to www.caninearthritis.co.uk. There is years and years and years of work in there to try and help you guys look after your dogs better. All right, see you later.